Hello, I'm Dr. Rohini. Today I'm going to discuss about anemia in pregnancy. So first of all, what is anemia? Anemia is basically reduced oxygen carrying capacity of the blood. And how do we find out that patient is anemic? That is by checking a blood protein called as hemoglobin, which usually carries the oxygen. So now, what is the cutoff for calling a patient as anemic or not? So according to WHO, if a patient's blood levels, hemoglobin levels is less than 11, then it is considered as anemia. Now, this is in the first and the second trimester. And after 28 weeks of pregnancy, a cutoff of 10.5 is taken because there is more of dilutional, more of water content in the body. So this causes a little bit reduction in the hemoglobin concentration. So 10.5 is considered acceptable. When patient comes to us and first of all, we do a CBC, that is complete blood count, as a routine evaluation of all pregnancy patients, and that gives us an idea whether the patient is anemic or not. There are certain symptoms also which the patients will tell, which will help us to identify whether the patient is anemic. So in case if you're feeling dizzy, you're feeling excessive tiredness, and if you feel breathless even when you walk for a small distance or you do some usual work, you feel tired all the time and you feel weak. So these are some symptoms of anemia, but these symptoms are also seen in every pregnant woman. So we have to differentiate whether it's because of anemia or because of pregnancy. So there comes in our blood evaluation. So now that we have come to know that the patient is anemic by looking at the hemoglobin levels. So now next what we will do. So people, there is there is this common thinking that all anemias are due to deficiency of iron, and patients think that if we take iron tablets everything will become okay. So no, that's not true. There are many causes for anemia. Yes, one of the most common causes of anemia in pregnancy is definitely deficiency of iron. But there are other conditions, like there may be genetic conditions like hemoglobinopathies, like thalassemia, sickling. These are found in specific, more commonly found in specific locations. Other than that, there is also, see, bone marrow is responsible for production of all this hemoglobin and red blood cells which carry the oxygen. So in case if there is any condition which is suppressing the bone marrow, that is there is aplastic anemia, or say there is some long-term medication that you are taking for other conditions like methotrexate, which is given in case of treatment of ectopic pregnancy, or it can be given for other autoimmune conditions. So this also causes suppression of bone marrow. So this will also result in anemia. Then other vitamin deficiencies like folic acid and vitamin B12 deficiency, this causes megaloblastic anemia. Then there's another type of anemia which is called hemolytic anemia. So in this, the RBCs are produced, but these RBCs are getting destroyed more and more. So this happens when there is splenomegaly, or there is any recent fever or other autoimmune conditions. Auto can also cause this anemia. So autoimmune conditions are basically conditions in which the cells of our body attack other cells of our body. So there are proteins which attack the self cells. So these are called autoimmune conditions. So these are few causes of developing anemia. So for further evaluation, so it's not enough that we just know that okay, hemoglobin is less than 11 gram. Now let's start the patient on iron supplementation. No. Now we have to do further evaluation to find out what kind of anemia is this. So for that, we will be doing a couple of blood tests. Apart from CBC, that would also give us an idea whether patient is having iron deficiency or B12 or folic acid deficiency, because there are certain in a complete blood count, if you would have seen the blood test report, there will be other factors like PCV, MCV, MCHC. So these values also helps us in getting an idea whether basically these values tell us the shape of RBC and the size of RBCs. What we have seen in iron deficiency anemia and genetic conditions like thalassemia, the size of RBCs is less. So that MCV, PCV gives us an idea. And in case of megaloblastic anemia, that is B12 deficiency, the size of RBCs are big. So that is also known if the PCV and MCV is increased. So this is one test. Now next is peripheral smear, where we will be taking a small drop of your blood and smearing it on a glass slide and looking in the microscope to see what is the shape of the red blood cells. In case of iron deficiency anemia, the red blood cells will all be of different shapes. It will be teardrop, it will be pencil shaped. At the same time, in case of megaloblastic anemia, there will be megakaryocytes, big RBCs. So yes, I would not get into too much of detail, but yes, peripheral smear, we will get an idea about the shape of the cell, which will help us in differentiate, at least diagnosing iron deficiency, microcytic anemia, that is iron deficiency, So iron deficiency, thalassemia, as well as vitamin B12 deficiency. Now next, other serum blood levels of iron. So iron studies. So in iron studies, we will be seeing total iron binding capacity, serum ferritin levels, and transferrin levels. So serum ferritin, most importantly, it gives an idea what is the iron storage in your body. So if the serum ferritin is less, then this patient will be having a iron deficiency anemia. And other than that, we would be checking serum vitamin B12 levels and folic acid levels. This also will give us an idea. And apart from this, if we have strong suspicion that even if all these tests are normal and if patient is still having anemia, then next test would be doing a test called HB electrophoresis, hemoglobin electrophoresis. In this, this is a much more advanced test in which by a method of testing called electrophoresis, we would be studying the hemoglobin structure, and we would get to know what kind of hemoglobin is there. So, in case if whether it's a normal adult hemoglobin pattern of HbA2, or if it is thalassemia pattern, or patient is having sickling pattern. So these diseases, sickling and thalassemia, usually they are genetic disorders. So they are usually transmitted from your parents to you, and at the same time it can be transmitted from you to your baby. So now we have got to know how to diagnose anemia now. What kind of anemia? From this we will get an idea. Next thing is I want to talk about how anemia is going to affect your pregnancy and your baby. So as far as pregnancy is considered, I told you that the usual symptoms of tiredness, dizziness, and breathlessness, and all these things are much more aggravated when the patient has anemia. And then other than this, there is chances of getting more chances of infection during pregnancy, because your immunity is reduced, and there is more chances of getting urinary infection. There is also increased chances of getting preeclampsia, that is blood pressure in pregnancy. There is more chances of getting bleeding during pregnancy, that is antepartum hemorrhage. And even during the time of pregnancy, and during labor time, what we have noticed that patients with anemia do not get good contractions. And there's also one very serious complication. If anemia is unattended and it's very severe, patient can also land up in heart failure. And after the delivery, patients are at increased risk of postpartum hemorrhage, that is excessive bleeding after delivery. And they are again more risk of getting wound infection. Suppose if you have undergone a cesarean, or if you have undergone a vaginal delivery where a cut is given in the vagina, that is episiotomy for delivery of the baby. So this wound healing is also affected in case of these patients. And also they have chances of getting more thromboembolism, that is increased blood clots, formation of blood clots in legs, chest, which is a very grave condition. So this is what happens to the woman during pregnancy. Now how it is going to affect the baby. So for the baby, during pregnancy, initially there is increased risk of miscarriage. There is increased risk that the baby will have low birth weight, increased risk that the baby will have IUGR, that is intrauterine growth restriction, and also that baby will be born before time, that is there is more chances of preterm. This is how it's going to affect the baby. So now that we know about signs, symptoms, and we know how it's affecting pregnancy, we know how to diagnose. Next part would be treatment. So now I'll just tell you briefly about treatment. So treatment will again be based on the type of anemia you have. If you have iron deficiency, then you will be treated with iron supplements. If you have vitamin B12 deficiency, then you will be treated accordingly. So in case if you have hemoglobinopathies like thalassemia or sickle cell, then we would be giving blood transfusion. And even in case of other vitamin deficiencies and iron deficiencies, if you have severe anemia, if the hemoglobin levels is less than 5 or something, then you would be treated by giving a blood transfusion. So with this today, I'll just end this topic. I will talk in detail about all types of anemia in my next few videos.